Hello and welcome to Askimo TV. I'm talking today to Dr. Feilim Murphy. Dr. Murphy is the clinical lead for Paediatric Surgery and Urology at St. George's Hospital in London, specializing in undescended testes and incontinence. Hi, Dr. Murphy, how are you?
I'm fine, thank you very much.
Dr. Murphy, the topic today is urinary tract infections in children. So, what is a urinary tract infection?
Well, urinary tract infection is an infection within any part of the urinary system. So an infection of the kidney, the area from which the kidney drains into, which is called the renal pelvis, the ureter, which is the tube draining down, or more commonly the bladder itself. So it is an infection of any part of that urinary tract which can cause irritation. The vast majority of urinary tract infections are thankfully related to the bladder, and therefore lower urinary tract infections. Anything above the bladder heading up towards the kidney is called an upper urinary tract infection, and thankfully is less frequent.
What causes urinary tract infections and who's at risk?
Well, the most common risk group, if we take the overall population of children, is of course girls. So girls, as we're all aware, have a much shorter urethra, so that's the tube from the bladder to the skin. And if you put it in a very simplistic terms, it's a much shorter journey for bacteria to go from the skin into the bladder itself. However, lots of people have other risk factors for urinary tract infection. A common risk factor is dysfunctional voiding, or failing to empty the bladder on a regular basis. If your bladder is not emptied regularly, it acts a bit like a pond that doesn't get all that fluid out of it, and you can easily see why there could be an infection in that situation. Another reason, of course, is constipation or difficulties in emptying the bowels. That can cause difficulties in the bladder to empty. There are problems from in the spine that can cause difficulties in both the bladder and the bowel to empty, and there's a number of congenital abnormalities and congenital defects that children can be born with that can cause difficulty in emptying one's bladder. You can imagine things such as anorectal malformation or spina bifida, in which the nerves of the bladder are affected. Otherwise, the vast majority of children who have a urinary tract infection have relatively normal anatomy, but may have difficulties in all the urine emptying all the time. So things such as the psychoureteric reflux are also being linked and associated with urinary tract infections.
What are some of the signs or symptoms of a urinary tract infection that may indicate I should take my child to see a doctor?
Well, that's a great question, because it very much depends on the age of the child. 10, 15, even 20 years ago, it would not be unusual for the majority of children who had structural abnormalities, so had a genuine abnormality of the urinary tract, which would make you more likely to get a urinary tract infection, for that to be undiagnosed. Nowadays, the majority of the time, these are being picked up on antenatal scans. So parents are entirely aware of what's going on with the child before the child is even born. Therefore, they're much more aware of any variation of the child in the first few months of life. So for a young child who has a diagnosis of there being an abnormality on the antenatal scans, those parents are informed that any real abnormality or temperature in which they're not happy with, they should get their child's urinary tract or urine assessed. Now, it is very difficult with a young baby to diagnose a urinary tract infection as a parent, because they're not going to start screaming at you that their wee hurts, or they have pain in their side, or that they have a pain at the top of their penis. That's not what children do. It's not even what older children do. They can be quite difficult at communicating that they have these symptoms. So for a young child or a baby, it is a high temperature in which most experienced parents know that this is not an upper respiratory tract infection. This is not the same as their other children have had. This is something different. And there's no reason in that situation that the parent could not bring the child and get the urine assessed. In older children, of course, they will start complaining of high temperature. They may feel nauseous. They may have a pain in their side if the kidney is inflamed, or they may just have a sensation of frequency, urgency, foul-smelling urine on voiding. Not all children who have unusual smells in the urine, have urinary tract infections. But if the parents are worried, they can always get the urine assessed, particularly if the child has a high temperature.
What treatments are available for urinary tract infections?
Well, there are a number of short-term and long-term treatments. It's important in the short term if the child has a urinary tract infection for them to be treated with the appropriate antibiotics. So therefore, it is very important that the urine is captured and sent to the lab and grown, and bacteria that's there is assessed, because it's not infrequent that the child could be started on one set of antibiotics and that needs to be changed. So it's very important that the urine is caught and assessed and antibiotics are started appropriately. So therefore, the immediate infection is dealt with. But it's also very important, in my opinion, that we actually resolve what's going on. There are a number of different national guidelines. In the UK, there are a set of guidelines designed for the appropriate investigation of these children. My personal viewpoint is that any child who's sick enough to attend a hospital or sick enough to be hospitalized with a urinary tract infection at any age should have at least an ultrasound scan performed to assess what's going on. And sometimes children are quite sick at home and never make it into hospital. So if there is a genuine history of urinary tract infections, I would always at least do a baseline ultrasound scan to assess the renal tract. After that, there are other tests and investigations which may be appropriate or not. The majority of times they're not worthwhile doing. It is important that the child's seen and assessed, has a proper history taken, working out all those risk factors that may be present, looking at those issues of dysfunctional voiding, looking at constipation, looking at family history of urinary tract infections, looking to see if there's a family history of reflux, and then making sure on physical examination that there's no abnormality in the spine or elements of constipation or abnormalities of the foreskin that may be contributing to all these issues. So, like everything in life, taking a good history from the parents and from the child when they're old enough, and examining the child is really one of the key steps in diagnosing any condition.
Thank you, Dr. Murphy. Thank you so much for talking to me today.
You're welcome.